Ongoing heavy rainfall across East Africa has resulted in widespread flooding, leading to hundreds of deaths across the region. Countries like Tanzania, Uganda, Rwanda, Kenya and Somalia are among those affected. Reports coming through say that at least 260 people have been killed across the region, with Kenya reporting the greatest number of deaths as 194. Rwanda has at least 65 deaths recorded. Rounds of heavy rain associated with the region's wet season have produced significant flooding since April. More than 100,000 people have been displaced. The flooding has also decimated 8,000 acres of crops, which are vital to the region. The heavy rain across the region has also brought water levels on Lake Victoria to some of the highest on record. Not only has this led to flooding along the coastline of Lake Victoria, which is one of Africa's greatest lakes, it's also threatening to disrupt hydroelectric power produced by dams on the Nile River, which is fed by the lake. Well, joining us now for the latest on the floods from East Africa, we're joined now by Marshal Mukuvari, who is the head of emergency operations for East Africa International Federation for Red Cross and Red Crescent Societies. Thanks so much indeed for joining us. Welcome to the program. Let's talk about the seasonality of these floods. Are they this bad every season, or is there something unusual about this year?
Thank you for having me. The first response to your question would be that we normally receive rains in March, April and May in East Africa. But this year, I would say that the phenomenon is seen relatively above normal rainfalls, which has resulted in the flooding.
Is this why perhaps it seems that some of these countries in the region are struggling to keep people safe and that people have died in their numbers?
Yeah. Strangely, the number of deaths from the floods exceeds the number of deaths from the COVID-19 pandemic. But the focus of the world and most of Africa to contain the COVID-19 pandemic can be attributed to the lack of attention.
All right, so this is becoming a forgotten or ignored emergency.
We could say it's not getting international attention in the media, but the Red Cross as an organization is very active, is on the ground, responding to the needs of the affected community.
All right, so what does this mean in terms of risks of, I guess, waterborne diseases in a situation like this where people survive the rain perhaps, but then with these floods, there's all these waters that perhaps can carry all sorts of contaminations?
Yes, you cannot rule out cholera disease outbreaks, malaria, the effects on malnutrition. You will also realize that the recommended protocols for COVID-19, social distancing, isolation, staying at home is not possible when people are staying in camps.
Now, you can do the best you can, but I'm guessing that access might be a challenge for you.
Indeed, there is some restrictions because the roads are washed away, bridges are broken down. But we do have, as a Red Cross, volunteers who are based in the affected communities. So that is enabling us to get information and also access to give education on health promotion to the affected people. But indeed, there is logistical challenges. Even if you look from the international perspective, travel restrictions will limit the number of people who can deploy to help these affected countries.
And one of the things that's peculiar to Africa is that women mostly are the ones involved in subsistence and small-scale agriculture in the rural areas, and often their husbands and menfolk are in the cities. So that means there's a lot of women perhaps that are alone with children that are vulnerable during these floods.
Exactly. These are some of the at-risk groups. I can say at least 6% of the affected people are pregnant women and nursing mothers. 8% are families with disabled people. 6% of the affected people are the elderly. So this is a demographic that is quite at risk. They're exposed. But this is some of the families that the Red Cross and humanitarian actors are focusing on.
Do you need more assistance? And if so, in what form?
Definitely the assistance is required. The current response that we've been giving is a shelter support, emergency shelter to the people who are displaced. Food assistance is required. We've been giving cash grants to some of the affected people. So we do see the need for additional funding to the response operations that are ongoing.
All right, so we mentioned some numbers just before we crossed to you, but give us a sense of just how big this problem is and how widespread.
Well, in Kenya alone, we could say that 300,000 people have been affected by the flooding, and at least 130,000 are living in displacement camps. But across the affected countries, Tanzania, Burundi, Kenya, Somalia, Rwanda, we have nearly 400,000 people who have been affected by the flooding. And because of the forecast, which says more rains are expected until the end of the month of May, we expect the number of affected people to increase. We expect the number of deaths to also increase. We still have some of the people who are missing and unaccounted for. So we are doing search and rescue efforts, but the needs will continue to grow. And beyond the flooding season, people will need to reconstruct their houses. They will need to get access to health services, clean water. So the needs will keep growing with time.
What needs to happen between now and this time next year, Marshal? Because, you know, I'd hate to have this conversation with you again next year.
I think one of the most important things is when the flooding recedes, people need to go to safer locations which are not flood prone. So people don't build on floodplains. They build stronger houses that are more resistant and adaptable to the weather conditions. We also need to be better prepared, pre-positioning emergency stocks, pre-positioning food stocks. Also, early warning messaging needs to be sent out before the flooding. So using the Weather Service's scientific data to anticipate the flooding, the extents, and also advocating that people don't build on floodplains near rivers, near the banks. When the banks break, people will be in trouble. So that's what we need to do.
What are the authorities in these countries been telling you in terms of managing this crisis and preparing for inevitably what might be the next one in the next season?
We are working very closely with the national governments, the disaster management units of these governments to respond to the needs. They are quite at the forefront, leading in terms of coordination, assessments. But the resource limitation will always be one of the factors that affect the quality of the response and the timeliness of our response. And also, we cannot rule out the impact of the COVID-19 pandemic in terms of resource constraints, because there's quite a lot of effort, energy, and funding that is going into the COVID-19 response that limits the ability of countries and their governments to meet the needs of other disasters.
I think you mentioned it before, but food must be a big issue because a lot of these crops have been destroyed as well.
Yes, the food issue, and it's actually a food crisis because I'm sure you're aware from the end of 2019, most of East African countries have been devastated by locust infestation in Kenya, in Uganda, Ethiopia, Somalia. So they've had impact of the locusts which have affected their crops, and we are still projecting that by the month of June there will be another wave of locust invasion that will also devastate the current cropping season. So the food crisis, I think we can safely say that in the coming months, most of the East African countries will be in need for food assistance. Currently, there's needs, there's food deficits, but the situation will deteriorate.
And finally, perhaps to further compound all of this, what is the situation in terms of dealing with COVID-19 alongside these floods at this time, particularly in the vulnerable rural areas?
What we've been doing as the Red Cross is focusing on risk communication. So any contact that we are having with the affected people, we reinforce the messaging on washing their hands, social distancing, and also the signs and symptoms for COVID so that there is early detection, contact tracing, so that we're able to manage it. So we are doing as much as possible to educate people, to give them information about the pandemic, and to ensure that there is awareness, and also working with the authorities to encourage people who present with symptoms to also go and get tested, but also the behavior change and attitudes in terms of how they live within their communities. So this is the thrust of the work that we are doing, and the Ministry of Health and the authorities in the countries are also doing the testing as well as the contact tracing. So we're working closely with the governments and other humanitarian agencies to ensure that there is a high level of knowledge of the coronavirus pandemic.
All right, Marshal Mukuvari, we're going to have to leave it there. Thanks very much indeed for coming on the program, and let's hope that the assistance that you require to manage this emergency comes quickly. Thanks so much indeed for your time. Have a good evening.
Thank you for having me. Good night.
All right, that's Marshal Mukuvari, who's the head of emergency operations for East Africa's International Federation of Red Cross and Red Crescent Societies.